So, have you been told that your number is too high and your cornea is too thin and you can't get laser surgery or LASIK done? Then, what are your options? I'm Dr. Kumar, doctor from Dr. Rai Institute, Mumbai, and this channel of iLogs is everything to do with what's latest in vision and eye care. So in this episode, I'm going to discuss about ICL or a contact lens inside your eye, which can also be done with bladeless surgery. This is the latest, most modern technique to remove a high power with a thinner cornea. So the question here is, what is ICL? It's called an implantable Collamer lens. So if your cornea is thin, you place a small micro thin lens behind the brown part of your eye, which is called the iris, and on your natural lens. So between these two, we are placing this artificial lens. It's inside the eye. That removes your glasses and dependency on glasses forever. The best part here, it's reversible. So the advantage here is we are not cutting your cornea, we are not slicing your cornea, we are not making your cornea thinner, we are not removing a portion of your cornea, but we are still taking care of your glasses. So the confusion in the patient's mind is, what's the difference between LASIK and ICL? So this table will actually describe the difference between LASIK and ICL. So in LASIK, what we are doing is reshaping your cornea. In ICL, there is no reshaping of the cornea at all. LASIK is permanent, yes. ICL is reversible. Dry eyes is a higher risk in LASIK compared to ICL. Corneal thickness has to be good enough for you to be a candidate for LASIK, while that is not at all affected in ICL. Night vision. Some patients do complain of night vision after a higher power correction in LASIK. That chances of night vision problems in ICL are much lower. So ICL also comes to our rescue when suppose you had keratoconus, you had a cross-linking or you had intact. Now your number is reasonably stable after a few months. ICL can come to your rescue. So it's not end of all of it, but it's just the beginning. So don't panic. Don't think that because you have keratoconus there is no other solution. We can do post-keratoconus treatment and ICL. So the biggest fear in your mind as a patient would be that if you want an ICL for your eyes, what is the procedure like? Don't worry, it takes about 10 minutes. There's no injection to anesthetize your eyes, done under topical anesthesia, so it stops. We can make a cut on your eye with the help of a laser, which is called femtolaser. Once that is done, we put some protecting fluid inside the eye to protect the rest of the eye tissues, and then implant this lens behind the brown part of the eye, which is the iris, on your natural lens. All of this takes about 10 minutes. Once that is done, you are discharged the same day. You need to come for a follow-up for 2-3 days to make sure that the rest of the pressure of the eye is normal. And once it settles in, we always do the other eye after 3 to 4 days. So yes, both eyes are not done together like what we do in LASIK. They're done separately over a gap of 3 to 4 days. It's quite a simple procedure, not all that complicated. Next question would be about safety. Is ICL safe? The answer would be yes. It is FDA approved. So the US FDA has approved that yes, ICL can be done safely. 99.9% of our patients are very, very happy. We really don't need to worry. And really there are no major complications of ICL. So are there any risks or side effects of an ICL? Yes, some patients do complain of mild glare or halos in the initial stages of the procedure. The initial generation, now it's the 4th generation of design. Some patients did develop a cataract or glaucoma, but now it's not seen anymore. Of course, we do a detailed workup of angle checking, angle measurements, retina checkup, retinal photography, and then we tell you, yes, you're fit for an ICL. Believe me, friends, just because you want an ICL, your eye will be fit for an ICL. It doesn't so happen. You have to pass all these tests. Once you pass all the tests, we'll tell you, yes, it's possible for you, and then you can select that procedure for your eyes. The next most common question asked by my patients is, what would be the cost? So good news here is we have a lot of Indian companies making ICLs, which are cheaper. We have an imported company, which is an American company, which also makes ICLs, which are a little more expensive. And of course, if you want a bladeless procedure, where I do the incision with the help of a laser, so your main incision and your side cut can also be done with a laser, the cost will vary. So yes, ICL can be taken up by anybody and everybody, and it's not all that prohibitively expensive as far as India is concerned. For the longest time, it was thought that if you can't get laser done for your eyes, there is no other option. The good news for all of you is that ICL is a very good option today if your eyes are not fit for laser or LASIK surgery. For more information, feel free to contact us at Dr. Eye Institute. Any comments or any questions, please write in the comments below and we'll get back to you as soon as possible. This channel of iLogs is everything to do with latest in vision and eye care. Subscribe to this, make sure you're notified every time I release a new episode, and share with friends and family just to spread this awareness all about laser and ICLs. Thank you for watching iLogs, and do keep in touch with us for any questions or queries.